will try, along with my colleague from the panel, to drive in European health data space. Today is not about better care, but it's just better, it's not just better policies, better care. We'll discuss in this panel the European health data space against a real patient journey, ask what challenges are from the patient's point of view, from the technical point of view, and also from the point of view of the physicians. We have a lot of things to think about it, and yes, it will be a challenge. Could I have my presentation, please? Before starting our panel, I will just introduce you in European health data space, not that you are not knowing about anything about it, but just to reframe it. We have legislation from this year. It's supposed to happen something till March 2029. In the center of the concept, it's the individual electronic health data. So we put the patient in the center of the problem, as it's supposed to be. We have data user and we have data holders. And the data holders use this, in this concept, are primary user. And after the primary users, which is the healthcare delivery, then patient and the physician or the healthcare staff. And along with the patients, then primary user, we have secondary users, and here it's the challenges. Because primary user, patient and physician, theoretically, they know how to share their data between them and how to work with the data. But now we need to move from the primary user to the secondary user. So we need to use these data that are individual patient data in innovation, in research, and in policymakers. So with this introduction about the topic, I will invite our speaker in the panel for today, Ovidiu Bernaschi. Please take a seat. Adriana Alexandru. George Suciu. Nirvana Georgescu. And Sherban Timofte. So we already have a cluster. Woman there, man here. Yeah, it's nice to have this. Yeah. I will let each speaker to introduce themselves, because who knows better than what we have and what we do. Ovidiu, the floor is yours.
Good afternoon, my name is Ovidiu Bernaschi and I'm the country manager for Secured Quantum Services, Romania. I also represent a startup called Innovitech, and we work for SMEs in digitalization and cybersecurity. Secured Quantum Services Romania is a large American corporation that deals with quantum secured communications.
Thank you, Ovidiu. Adriana Alexandru.
Me? Yes. My name is Adriana Alexandru. I am from National Institute for Research and Development and Informatics, ICI Bucharest. I am a senior researcher first degree in the institute. I was previously head of laboratory, and I have been involved 20 years in managing projects in e-health. Then I finished with this who is managing this laboratory, because I'm a general director and then scientific director of the institute. Now I am a counselor of general director of institute. In the same time, I am a professor at the University Valahia of Târgoviște, dealing with information technology and modeling models for complex systems. Okay.
Thank you and welcome. George Suciu.
Hello everyone, I'm George Suciu Jr. I'm the R&D and Innovation Manager of BEA. BEA is an SME. We started as 35 years ago, and we do telemetry. That means telemonitoring, so we gather different type of data, environmental health, data from equipment, and we process this data, and based on the data we provide decision support or we provide automation systems. So thank you for this opportunity.
Thank you. Nirvana Georgescu.
Hello everybody, thank you for invitation. I'm a physician. My name is Nirvana Georgescu and I'm the Quality and Patient Safety Director for one of the largest private healthcare networks in Romania, Regina Maria. As part of the quality and patient safety, I am involved in many innovation projects and also in the development of the electronic medical record. So probably I will be today the speaker for the primary user. Thank you.
Thank you very much. Șerban Timofte.
Hello everybody, my name is Șerban and I'm here as part of EONCO Hub team. I will have the pleasure to introduce this initiative later in the presentation, so I don't want to take too much time speaking about it right now. My background is in the software engineering area and technical program management, leading initiative at national levels about hyperscaling clouds, sovereign clouds, and custom software based on the client's requirements. Thank you.
Thank you very much. So we have a diversity, as the Act is telling us that we have primary and maybe secondary user. Not necessarily we have between us the secondary user, but we will see how we, working together, we will make the frame for the secondary user. How we will have this panel, each of the presenter will present 10 minutes. After each presentation there is a Q&A session, so please be prepared to ask questions for our presenters. Okay, our first presenter is Ovidiu Benarski. Okay, you can use the floor. It's up to you. You can stay here, yeah. During the presentation it will be there.
Perfect.
But yeah,
I've sent it only 10 minutes ago, so I'm not sure. Have you received it?
yeah, we have all the presentation.
Excellent.
Yeah.
Yeah, the link to Google Drive, yeah. Yep. Please, thank you.
We prepared the first presentation, which is with us in this moment. I think it's coming. Meanwhile, what do you think about these electronic health records at the level of European level? Maybe with the physician first, yeah?
Wow, you took me by surprise. Strictly from the medical point of view, I think it is great to have access to medical data of the patient wherever he is. So, strictly professional, I would be very glad to be able to see everything that he comes with. strictly from the point of view of the physician, it might be overwhelming. So what we discovered is that we need something to help us organize all this information. So these are the two points. Is good, but we need organizing that data.
Okay, maybe from the technical point of view, how the techniques could see these opportunities. I will give you a mic, because I was instructed not to give my mic.
Okay, yeah, so from BEHEALTH side, we have worked before in such interoperability projects using HL7, and there are still ongoing research programs to do this interoperability, and I think it's a good start for connecting to the data spaces.
Do you think Romania is ready for this such of challenge?
It should be, but from the technical point, I think that there are, let's say, no major roadblocks. But from the administrative or from the financial point, there are.
Yes, if you say that technically we are able to do such things, who should be responsible? Or who should create this opportunity? Because we're talking about a lot of data. And
yep. So our main background is coming from telecommunication, but maybe I can hand over to a colleague on the cloud. So I think the government cloud could be one entry point for such data.
From my point of view, I have only good feelings about this initiative because, you know, now we all speak about AI. And the AI is not something that appears from nothing. It works on data. With this initiative, we have all the data structured in one place. And this breaks a lot of borders. About Romania, I think that, yes, we are ready. But we have some prep work to do before starting applying this initiative in Romania, because we have a lot of data. We don't have the power to process all this data.
okay, we will discuss this, and maybe we will try to predict if in 2029, as it's supposed to be ready for this challenge, we, as Romania, will be ready. But meanwhile, let's invite our first speaker for a 10-minute speech. Technical problems. Are we ready? This is technology, and I also told that the technology beats us every day. Even if we are literate in technology, some things could be wrong or not in an appropriate place, but we will be in one moment. Okay.
I've got a Linux operating system on my laptop, which is not always compatible with just regular Windows technology. So thanks to my colleague here, he managed to sort it out in the end. So my presentation is basically focused on cybersecurity. I am the country manager for Secure Quantum Services, as I've mentioned. I'm also a graduate of WCT University and the Romanian American University here in Bucharest. I teach at master's level at University Lucian Blaga in Sibiu, and I'm also an officer, communications and cyber defense officer in the Romanian Defense Corps. For my entire career, I basically spent over 19 years of my time in my professional time in various positions, in various technical and leadership roles, where I've accumulated large experience in dealing with data and with data governance and securing data. As you will see for the duration of my presentation, both PowerPoint and verbal for the next 3 hours, our role now at worldwide level is to secure communications. Due to the advancements in quantum computing, especially in Asia, our communications are quite open to harvesting now and decrypt later. That's how it's basically done today. And that decrypt later, it can be done within sometimes minutes, other times hours or days. The most important thing that I would like to point out here is that if we don't do something about data controls within data governance, it's as if we would speak to each other thinking that we are secure, but we are all on the same airport floor and everybody else can hear what we're saying. Clearly, in the medical sector, which is one of the critical infrastructure sectors under NIS2 legislation, the NIS2 directive, cannot afford that. So I will try to get through my presentation really quick because this is one of my presentations that I'm using also on Friday at the Romanian Science Academy to raise awareness that what we thought yesterday that it's science fiction, or that we might think today that it's science fiction, it's not anymore, and it's actually science fact. So it's our job and responsibility to secure the data that we've got, especially in the critical infrastructure medical sector. I'm going to skip a number of slides because I've already sent the PDF from my presentation. So if you'd like to click on the links or get additional info on the slides that I'm skipping, please feel free to contact the organizers, and they've got my permission to share it with you. Right. The most important thing that we need to understand today when it comes to data governance is that people, or script kiddies, as I like to call them, they don't hack systems for the sake of boosting their ego or for the sake of pleasure anymore. That's not happening anymore. What's happening is that artificial intelligence is being used maliciously and automatically to attack systems. So this, again, is not science fiction anymore. This is science fact, and it's a very serious issue at critical infrastructure level. So GSET risks is basically an acronym that stands for geopolitical, economical, social, ecological, and technological risk. What this means is that we cannot afford to look at one sector anymore and we'll say, okay, we'll secure the medical sector. We don't care about energy. We don't care about transport. We don't care about anything else because we're only operating in medical sector. Our world today is so interconnected by technology that we need to start thinking holistically, and we need to start thinking, considering here in Romania, we've got a very clear geopolitical issue. We need to start thinking about the hybrid risk and the hybrid war that we find ourselves in. The documentation of these risks on our identity, on our data, have also been published by the World Economic Forum. If you go to WEF to their weforum.org, you will find the full details about each sector and the risks that are that they've basically analyzed and they've reported on including the medical sector. So I encourage you to do it and document yourself specifically on the risks that are now at all critical infrastructure sectors. All this conceptual story is fine until we realize that we wear on our wrist, we wear in our pockets, we wear on ourselves, on our body, various devices that actually use artificial intelligence. These devices, if they're not secured properly, the data that we are sharing with them, including highly intimate biometric data, could end up in the worst case scenario at marketing companies, and then you'll just get spam and phishing emails. But your data could end up in the wrong hands, and those wrong hands that I'm not going to go into right now, those wrong hands could profile you, and you become a vulnerability for your organization if you don't learn actively and dynamically and holistically how to secure your own data at individual level. Right, so AI is now integrated in all sectors of society, and no company that wants to be competitive and maintain their competitive advantage can afford not to use AI today. We are maybe used to AIs as being ChatGPT. ChatGPT was the first LLM, large language model that was launched at worldwide level. Now, ChatGPT is not the only one. There are many more. One of whom is Copilot from Microsoft. The other one is Gemini from Google. On the right-hand side in the table, you will see many others that are compared, that they've got their capabilities compared. So AIs are not just talk buddies that we can interact with or assistants for various tasks that we need to do at work. AIs today can create through various APIs very serious threats because they enter other organizations. They enter the servers, they enter the communications networks of of a target company. And if we don't know how to secure our own infrastructure with a better AI, then we are, as I mentioned at the beginning, we are speaking on an airport floor, thinking that we are secure and nobody else would hear us. So I'm going to stop here because the rest of my presentation is available in PDF. We need to understand that there are two types of AI today. Right. So there are two types of AI today that are personified by the angel and the demon. On the left-hand side, we've got a screenshot from ChatGPT that is helping us write a code that would help us defend the network. And on the right-hand side, we've got WormGPT that obviously is helping hackers and malicious individuals, actors, to attack networks and steal data. So I'm gonna stop here, and we can continue later on after the other presentations. Thank you for your attention.
Thank you for your presentation and for being today with us. If there are any questions from the room? Nobody? Maybe there are questions from the online? Not yet.
Maybe a question. Yeah. So statistically, how much of AI is used for the left side and how much on the right side, if you have the figures?
Thank you for the question. Thankfully, over 50% is used for defense, because this is not something new. This is something that we were able to work with AIs back in 2010 and back in 2011, knowing where the trend is going. So companies that are truly professional companies and have true capabilities, not just snake oil marketing, they are prepared since a decade ago for what's happening today. But I don't want to mention any names of companies, but if you search online, you will find, or if you speak to various professionals, they'll tell you what companies truly have the right solutions to protect the networks against the malicious attackers. Thank you.
Thank you very much. Is there any system that could protect totally the system? Then without, yeah, for you, without any security break, let's say, is there any system able to protect healthcare data in healthcare space, healthcare data space, 100%?
No, absolutely not.
Yeah, so for what we are preparing now in these circumstances?
The reason why it's a very clear no is because of social engineering. It doesn't matter how many layers of security we implement at technical level and at digital level. People will always be hackable because they don't listen. We train professionals, people who have sometimes PhDs, but they react emotionally in the moment when they see a man sees a beautiful girl with a stick in her hand, and it's like, here, check this out. This is a present for you. Oh, sure. Let me plug it into my laptop and see what that does. So until we realize that people are the actual vulnerabilities in all critical infrastructure systems, we will never be able to deploy a solution that will include the protection of people as well.
Maybe to protect the people from themselves.
From themselves, yeah.
Yeah, thank you very much.
My pleasure, thank you.
Thank you for your presentation. Our next guest is Adriana Alexandru. Please, the floor is yours. Steal the mic.
Hello again. As I told you, I had a presentation from the National Institute for Research and Development in Informatics. The title of our presentation is European Health Data Space for Preventive, Personalized and Remote Care of Older People and Individuals living with neurodegenerative disorders. And we want to bring innovation and ethics in AI-driven health systems. Please. Next slide, please. Ah, excuse me. I have here. First of all, I have to speak a little about our institute, ICI Bucharest, and as I told you, we have more than 55 years of activities and more than 25 in e-health domain, having a solid background in this domain, and we have a variety of systems referring to hospital information system, remote monitoring, electronic health records, image processing, diagnostic and treatment support, and health education and prevention. Our main objectives and activities in health are elaboration of studies, research and development in innovative solution and IT application for health. And another one is developing e-technologies for prevention and healthcare for digitalized, personalized, preventive, and proactive medicine. We speak today about data, and these data are collected from patients. If you see, Romanian has a lot of older people, and it is an accelerating aging of the population worldwide, and Romania is not far from this acceleration era, because a new big amount of people with older ages will be when the people born after 67, I think, after the laws putting on in 6 years, will be retiring. And it was a huge amount of aging people. And this amount of aging people are causing social and economic changes in our life. And we want to better and faster implement emerging digital technologies in order to create an age-appropriate services and environments. As I told you, we refer to elderly people. These elderly people now are not those from 50 years ago, because they are better informed, they are better connected to internet and smart devices. They want, excuse me. Thank you very much.
It's okay, you can continue.
They want to manage their own life and use some smart devices in order to be independent, to have daily activities and well-being increasing every day. And for this aim, we want to promote remote health monitoring for elderly patients, which implies the use of technology and devices which are adapted to the functionality associated with age. What we want to do is not to deliver such application for clinical sites, but also for non-clinical settings. We want to deliver some application for people, old people be able to live in their own homes, because at a certain age it's difficult to take old people away from their home. Another aspect of our era is that all the people are much in a stress, has a much larger stress than before, and also returning from aging people, the age is associated with neurodegenerative diseases, and we want to have some application for people with Alzheimer's disease, Parkinson's disease, and multiple sclerosis. We want to use smart assistive technology and predictive digital tools in order to assist these people, to support them, and also to provide not only assistive technologies, but also predictive tools in order to promote aging in place strategy and to sustain the autonomy of these people, avoiding their going to hospitals, and because they are in much physical better situation in their home if they consider to be safe. The European health data space is a strategic opportunity in order to unlock the value of health across Europe. One of the benefits of EHDS is the development of robust and generalized AI models, which have to be personalized, also timely remote intervention be possible with them, in order to early detect the dementia or frailty risks or some other problem associated with aging. And in order to ensure the interoperability between national systems and to allow Internet of Medical Things IoT devices to be integrated into official care pathway and HHR system. It's one of the aims of our national and European activities. As Sorana told at the beginning, patient is the most important in this period, and the patient has to be empowered by this European health data space in order to have to strengthen the role of individuals in managing their own data and in order to have independence and to be able to age in place. My aim of the aim of the presentation is to present two of our applications developed under Romanian projects, and this application used Internet of Medical Things and artificial intelligence, particularly for aging population and with population with dementia and frailty. This application are smart aging systems and a NeuroPredict platform. First of this Neuro smart aging system is dedicated for elderly people and want to remote monitor their activity and wealth, and in order that the general medical personnel be able to see if something is wrong with these people. This project is finished and has been tested in the laboratory. The next project is NeuroPredict platform, which wants to develop predictive models for prevention, early detection, and monitoring of long-term conditions from patients with neurodegenerative disease. The basis of the hardware used for acquiring this type of data are those of raw smart aging system, and we added some new functionalities. As I told you, it's for Alzheimer, Parkinson, and multiple sclerosis, and the system will be able to be used in clinical and non-clinical systems. The project is ongoing, will be finished at the end of next year. For both projects, in order to be tested in clinical environments, we have conversation with Ana Aslan Hospital, with Dr. Prada, and we have a protocol that will allow us to test in real cases of persons in this hospital. First, I'll speak about the first project, Smart Aging project. I'll go very quickly on my presentation in order to finish in time. The objective is just to support active and independent healthy aging. And this system wants to create a smart environment to monitor daily activities and lifestyle of the person. It is a non-invasive monitoring of the person, and not only with sensor wearables for collecting medical parameters, but only with discrete environmental and other sensors. All the data are transformed to a cloud platform for storage and aggregation, and also from there the results will be presented and used in advanced analysis. We also have used questionnaire in order to assess the health status of the patient before and after using the system, and the acceptance of the IOMT devices. It's for elderly, also is for medical staff, because general practitioner can use it to monitor the health of patients. And for each patient, it is a personalized management of the health, because for each illness, are some specific wearables which will be provided for patients in order to monitor their health. Also, because there are older people, they have to have personal caregivers or family members in order to assist them. And this system permits this person to interact with the doctors and also to see the current state of the health of the patient. A general architecture of this system is with the first level of acquiring data, then transmitting, using age level in order to fast process the primary data in order to can have alarms for if something is wrong, and then cloud layer where the data are analyzed and predictive analysis is eventually made, and the data are presented to users. The system has a monitoring component which monitors data from IOMT and provides management and transmits this data, as I told you, first to fog or edge level and then to cloud for processing and analysis. These monitoring components have these sensors and devices, and here is details of these devices and the function they can provide. As I told you, there are not only medical devices, but also environmental devices, and we implemented two black boxes. One is for medical black box, and another is environmental black box. And here is an explanation of what parameters are provided by sensor for these two medical and ambiental black boxes. Besides this, we use some depth camera in order to monitor the daily activities of the patient. In order to centralize in a single point with control access and number room functionality, we structured information for each type of user, being general medical and patient and the people which are helping the patient. These data are providing for being viewed by persons, excuse me.
That you have two, let's say, solution for clinical practice monitoring, and I'm wondering if I am a patient, for example, who owns the data and where my data will be.
We provide these equipments to general practitioner, okay, private general cabinet in general, and each of these cabinets we have the hardware necessary for a number of patients. They provide this hardware, that is such wearables. This is the hardware and the environmental sensors to be put in the houses of older people, and all the information will come back to the general practitioner in order to be analyzed, and he could act in real time because some alarms are also providing him if something is wrong.
Okay, so if you have, let's say, 10 GPs that has in the project, yeah, then means we have 10 points where the data are collected.
Yeah.
Where are data integrated somewhere?
Not until now. There okay. is only used by the current GP.
Okay, so we have fine examples in Romania for, let's say, central patient use of the health data care. Do you have any questions? when can you share this model with all countries?
I don't know, because if, as we told before, European EHDS, European
Electronic health.
electronic health record for Romania is not ready yet. As I know, there are different systems with different data structure, and there are not interoperability in between. And when everything will be in the same format, it's not difficult to adapt our output to this format and to provide this data.
Okay. Other questions? No one? No? Thank you very much
Okay, thank you.
for your kind presentation.
I take my glass.
Our next speaker is George Suciu.
So, hello. I think we have also some slides from BEA. And just as a follow-up, we collaborate with ICI Institute, so we had several proposals and joint projects as well. So our title is Shaping the Future of Healthcare, so we are looking now at the next framework program and the next years, how healthcare can benefit from the innovation programs and collaboration, so also from this impressive community of ROHEALTH. I think it's one of the most active clusters, and thank you also Flaviana. I met her many years ago in Brussels, and she was very, very active there. So, from my side, I graduated technical background, also PhD in time-critical cloud computing around more than 10 years ago, and participated in different projects. There are some projects such as Stamina on pandemics, safety security of hospitals. Recently, we completed a project Mobilize on a mobile laboratory. And yeah. About BEA, we started as an SME, slowly grew. Now we are around 80 people, professionals in different fields, and we work with medical stakeholders on topics such as health safety, and here are some of the ongoing or main projects. So Shift Hub, I will go into more details. Then, as I mentioned, one-stop health mobile laboratory. It's like a truck, costs €500,000, and you can do a lot of point-of-care tests for infectious disease, Zika, West Nile, and so on. And then we have also several projects on cancer, OncoScreen and OncoDir, and then also on cross-border detecting different anomalies. Also, one project that is important is the project called DOME, which is towards having an open marketplace. So it's one of the European initiatives to compete with Amazon, with the cloud of Amazon. You know, recently they had several disruptions, and several other projects on security and on production value networks, such as Arrowhead, ECI Bridge. And we are looking also at the environment, how the environment is affecting the health of the plants, of the animals, and ultimately on humans. And several projects on smart wearables, textiles, and so on. You can see also the areas of activities. Our main background is telecommunication, and then telemetry and solutions for AI now in call centers, detecting different emotions, and as well integrating solutions for energy efficiency, and then going towards to the cloud. So here is a picture of some of the reference projects. We started, for example, with projects on monitoring wearables, and we went also through decision support systems. And now we are running several projects on cancer screening and directives. So I will go more into ShiftHub, which is a hub. To be more precise, it started in 2023. Now we are closing to the end of the project. We have several partners, and the coordinator is Steinbeiß from Germany. And it's one of the support actions. We had different events, different workshops, and there is also a community. It's online, and I will also show you the way to register to the community. We had also investor pitches, so how to go to the market with different innovations. And there are different challenges you have seen also today in the introduction and the other speakers, so aging population, shortage of healthcare workers, now the pandemic as well, and the aftermath, and the costs associated to health. So what would be the solution is to have smart health, so using artificial intelligence, assistance, and this project still has some barriers to overcome. One of them is, of course, is data availability, so to have these data spaces, then to have quality data and different issues regarding interoperability. There's also the digital divide in Europe, East, West, and also in Romania, you can see. And we have also low acceptance by patients and doctors, so this is why we organize a lot of events and awareness campaigns, and we try to show the value of such a community. And here you see some examples. So we are scouting for startups or organizations that can join this community. They can promote without any cost. So the platform is operated by the digital SME organization, and we have there also possibility to access the health data space through a partner in France. There is also different recordings, catalogs of resources, and we are looking to replicate through living labs and digital innovation hubs. So here are some of the services that we provide for free for the healthcare community. So there are still 2.5 months of these projects, but the platform will be still operational after the project completes. And so we have the platform. You can experience what is a health data space. You can connect, and we have every 2 weeks onboarding webinar on the website. You can find the dates and how to connect. And we have demo days. Recently we had in Greece. We have also matchmaking as the BT Match is a similar platform. For each event you can connect, and the catalog of services that you have seen before. What we are targeting, of course, patients, citizens, then practitioners, providers, especially startups, then knowledge universities, research institutes, and financial intermediaries, and public authorities. So all are welcome. Here are also some opportunities for each. Maybe I will focus on the technology providers. It's a possibility to network, to gain more visibility, for the practitioners as well, to know about what solutions are out there. And of course we have the infrastructure. Last but not least is this funding opportunities. So we generate new proposals on the different horizon with other calls. So maybe some of you are familiar with the DIH. Anybody who is familiar with Digital Innovation Hub or is part of it? Okay. So in Romania there are different innovation hubs, and there are European Digital Innovation Hubs, and they provide services also for free. We are also part in such initiatives, and you see different services there, mainly on the digitalization. So you can test devices, or you can test services, you can get free training, and support to find partners for internationalization. So in ShipHub, we follow this approach of open innovation. And we have also some games there, so some colleagues designed some games for playing, also through these games to increase the literacy. So yeah, some things about the consortium. So you see we are also a mix of different partners. We have from Romania the COPAC organization, Alliance of Patients, and the matchmaking is provided by the European Digital SME. So yeah, that's in short. If you want to scan the code, then you can go to the website, can register there, see the next events that we organize, and yeah, get in touch if you have any questions. Hope this is useful. And if still people are scanning, yeah. Otherwise, you can go to the shifthub.eu. So it's the website, and then there is a button on the right, join the community. So these are some proposals that we initiate based on the community. So there were some calls on environmental health, how the environment is affecting the health, and how AI is driving new applications in healthcare, and some other topics. So through the platform, we generated more than 20 proposals for the horizon. So we hope some or more of them will be successful. We are looking for potential partners. So if you think you can participate in such projects, then now there will be the new calls for 2026 and 2027. You can also put a profile there on the platform. So that's it. Thank you very much.
Thank you very much for your insights. I think that today information is power. And to have a lot of information from the same domain on the same platform, I think it's mandatory and it's welcome. My question is, why do you think that you have so low acceptance?
So we scouted around some thousands of organizations throughout Europe, and the success rate is maybe from several thousands. We have onboarded around 200 or more technology providers, but it's maybe also because of the visibility of the platform. So we don't have presence in all the countries, so we are trying to cover from let's say, clustering some countries together to support the visibility of the platform. And yeah, it's also that we have done a lot of events in various settings, so setups. So we experimented with different ways on onboarding and attracting people to the community.
Okay, joining to the community, it's free of charge, or it's supposed to pay for enter into the community?
Yes, everything is free. So we still have 2 months and a half, so until the end of the year for the project. So you are welcome to join. And afterwards, the platform. We are now thinking also of monetizing the platform. So in the future, there could be some fee for new onboarding.
Okay. Did you think the platform also as a possible pool for citizens to join, let's say, clinical trials?
Not yet.
Not yet.
So
okay.
That's a good idea. Thank you. Yeah.
Yeah, I think it will be a good idea because at least in Romania we don't have a central point where to go. For example, have a participant to see what clinical trials are ongoing in Romania, and if you are eligible on, there is one?
The National Medicine Agency is working on something like that. As far as I know, they promised us.
Okay. Okay, that's nice to have it. Maybe if they have it for clinical trials, you will can have a platform for, let's say, populational studies, which are observational studies, are not clinical trials, and maybe it will be an idea. Okay. Yeah.
Thank you for your presentation. It was really interesting, and I think we can cooperate on a number of things that we'll discuss offline. Now, I'm going to return the favor and ask you back a question. Some of our clients own medical clinics, which are hybrid. I'm thinking about a very specific client of mine right now. His clinic, or well, their clinic, is half. One building is stomatological, dental clinic, and the other building is with 40 beds or so for surgery, for various daycare, and various other medical procedures. Now, they specifically asked me to provide them a stable, secure, and reliable information system that would cover both of their buildings and both of their businesses, even if it's just one company overall. Do you have any solutions as an information system specific to both medical, general practice and dental? Thank you.
Thank you, Ovidiu. Yeah, one pass in my career was also to go to stomatology, so but I did not choose that. But yeah, indeed, on the marketplace you can find also providers for such medical information systems. I know there are also open source ones, so you can also use that one, but there are also some vendors on the marketplace. So yeah, there are solutions out there. I think also Romanian, if I remember correctly, there were also 1 or 2 solution providers from Romania. If you want, I can get you in contact, so yeah.
Okay, thank you very much. If there are any other questions from the room? No? Then we will have also a discussion at the end, so...
Okay, thank you.
And we will take also the question from the online. Thank you very much. Next of our speaker is Nirvana Georgescu. So we are going back to the primary users, to the patients and to the physicians.
I think I need a little adjustment. I don't know if you can hear me very well. Thank you for the invitation. As I mentioned in the beginning, I'm a physician and I'm here to represent, I would say, an experiment about the way that we provide integration of medical data. I'm working in Regina Maria Healthcare Network. We celebrate this year a double anniversary. We celebrate our queen, 150 years from her birth, and we celebrate our 30th anniversary. So this is our logo for these days. I don't have, oh, yes, I have. So just a few words about who we are. We consider ourselves to be one of the most digitally integrated healthcare networks. We have a wide span of institutions, starting from hospitals, polyclinics, imaging centers, and laboratories. And we aimed for years and years to create a single ecosystem where we can connect patients, clinicians, and operational data. And we worked towards this digital transformation and position technology as a strategic pillar of our development. I will speak from several perspectives. I will speak from the perspective of the patient, then from the perspective of the clinician, and then from the perspective of my department. So the patient. The patient is enabled to access his medical data, his medical information. We have created this application, this medical portal, where the patient can have access to his own medical file, but not only. He can have an end-to-end digital journey. So he can get information, he can access scheduling, appointments, he can see all the medical content of the consultation, he can see the recommendation of the physician, he can also have information about the electronic recommendation of the physician. He has a follow-up post-appointment, and we are very careful with this follow-up. I will tell you a little bit more. And this is the trend from the last 3 years. There is a big adoption from our patients of this electronic platform. The shift was already made. More than 50% of the schedules are made online. So they are really loving this application, and we really hope that we will help them in the future. And also you can see that we have a virtual clinic with more than 200,000 consultations this year. There is another thing that is happening, and we think that is helping both the patient and the physician. The patients are prompted after the consultation, and they are asked to complete a questionnaire. One question from this questionnaire is about the physician, so the patients are allowed to give a note to our physicians. It's very clear that it's about the interaction with the physician, not about his medical knowledge. And we are very proud to say that more than 90% of the physicians working in our network have a grade of 9 or even more. And also the patients are allowed to give us feedback regarding any type of aspect of their interaction with our clinic. So this is the patient perspective. And I think that in this meeting, the access to the personal data, the access to the history, medical history, the possibility to use this medical data wherever they need is the most important feature. For clinicians, we have several applications, all of them interconnected and all of them bringing the information together. So I wanted to say from the beginning that I can present you some very beautiful things. Believe me, I will be available to explain to you all the problems that we had behind these beautiful things. So at this moment, we have a learning hub. It's an intranet platform where everybody can subscribe to different types of trainings, courses, and so on. We have a platform for accessing our procedures and protocols. So that wiki platform is also for clinical guidelines. We have a big intranet. And also the physician have a special portal where they can access from outside the clinic the medical file of their patients. Why? Because they are in connection with the patients can contact them while they are not in the office, so they can have access only to the medical file of their own patients. Also, the physicians are working with several forms of electronic medical files. So we have a general electronic health record, which is called MedPractice, and is used in the outpatient settings. We have a special platform, a special application for occupational health, a special application for family physicians, and of course, a special hospital informatics system. All of them bringing together the data. This was a big challenge, and we are happy that we can do it. And imagine that we also can see laboratory data in dynamics, imaging data, not only the text, the interpretation, but also we have connection with the PACS, so we can see directly the images from the investigation. Of course, we use artificial intelligence, and we will use it more and more. Right now, artificial intelligence is a very important feature used in radiology. There are several types of artificial intelligence used mainly in CT, in thoracic, thorax, CT, and radiology. These are able to identify nodules and to highlight them to the physician. We have an artificial intelligence which was tested for mammographic lesions. We also have a brain artificial intelligence doing the same, trying to identify lesions which are not visible from the first sight for the physician, and for prostate. Also, we use artificial intelligence in laboratory medicine. Actually, it's a little bit the reverse. So here, artificial intelligence is mainly able to detect normal samples and take them out from the, of course, it's in anatomopathology. And this is easier for the physician because they are able to focus more on the pathologic samples. In the left side of the screen, you can see actually all the applications that are used in our network for each division that is working in the network. So you can see we have an important infrastructure, and we work with a lot of interconnected applications. Somehow I wanted to tell you about introducing technology in hospitals, and the only picture I found was about the robots. So every hospital has a robot. We are very proud of this. And now I'm coming to to my field, to the quality and to using the data. Because yes, we are sitting on a pile of data. And what are we doing with this data? We need to improve. We need to improve operational flows. We need to improve quality and patient safety. So we started to organize the data, because you need to know that they are not very well structured. So we started to organize the data, and we started to get information about what the results of our activity are for the patients. How good are we? I can tell you hours and hours about our performance, but somehow we need to measure it and to benchmark it. So the project that makes me proud is that we were able to structure the medical data, and we were able to measure, and we will measure more and more indicators. Right now you can see some indicators like readmission rate, mortality rate, reoperation rate, length of stay, patient satisfaction, and so on. We also monitor, this is an example, the antibiotic use, and also the way that we manage to screen our patients for severe diseases year by year. What comes next? There's a lot of work to do. We cannot stop here. We want to speak about artificial intelligence as an assistant for the physician in the electronic medical file. And I need to tell you that you scared me today with what you said about the artificial intelligence. Yes, we need to deepen interoperability across the full care continuum because we still have gaps of informations. We need to increase the automation of our operational flows. So there are lots and lots of places where we need technology, like operation room utilization, like hospital workflows, like infection control. I didn't put here, but you know, medication is one of the most important, most frequent reasons for adverse events in medical care. I don't know if in Romania anybody is speaking about the right way of prescribing and using medication. There are applications, I know that we will speak about oncology, and I'm very curious if there are any type of applications for correct prescribing of medication in our country. So I think that in the future we will be ready to have access to European data and to provide access for European physicians to the medical data of our patients. And now, if you want to know more about what's behind, I'm here. Thank you.
Thank you very much for your presentation. You talk about something that is very nice and beautiful, but you didn't talk about what is behind. And,
yes.
The work in the behind and how the physician and the patients embrace these technologies, because I think besides technical issues and monies and fundings, there are also a barrier in terms of accessibility. I want to do this, I want to be there.
I think that patients embrace this technology much, much faster than the physicians. Physicians say, I need to consult the patient. You ask me to work in a computer. So it's not as easy for them. And right now we discover that we have a problem, as I mentioned in the beginning. Our patients have been in our system for years and years. And at this moment, the medical file of a patient can have more than 100 pages. Whenever a patient can access a doctor, think about how this doctor will have to look on all these pages.
Navigate.
Yes. Yeah. Yes. So we need to find ways to enable physicians to have faster access and more structured information about the patient. All these data that we have have been gathered for the last 20, 30 years. Think about how these data were written in that moment. And think about, we need to find a way to structure all this data. So this is why it's more difficult for the physicians, not only because they don't have computer skills, but because it is a challenge to look in the medical file of a patient.
They need an
at this
IE
moment.
to structure the data and to
Sorry?
they need an IE, artificial intelligence,
Yes.
to extract the most important things from 100 pages and maybe to give them a briefing about the patient,
Yeah.
because otherwise to read 100 pages for a patient, it's too time consuming.
Yes, and since the data is not written in a structured way, it's more complicated, yes. And I think we are not the only ones, so.
Yeah, I congratulate you that you are at that level, because not many healthcare institutions are at that level. And I think that you are an example of good practice on how to do it. And maybe the rest of hospitals in Romania, or maybe at the level of government, because we don't have in Romania an electronic health record, let's face it, Maybe we will learn from your experience because it's worthless if you ask me.
Thank you so much. Maybe all the challenges that we have, those are the most important to tell about. Thank you.
Thank you very much. Other questions? Yeah.
A very number game. First of all, how big is the internal team and the external team that is behind this?
The internal what? Sorry?
Internal team. Team. How many people are behind the technical solution?
I don't know the dimension of our
Give the
IT
brackets.
department,
Give the
but
brackets.
it's dozens. So we have a big IT department, big IT support.
So under 100, yes?
Sorry?
Under 100.
Under 100, yes.
Okay, thank you. And also externally, probably.
I'm not very prepared. I was afraid of this type of questions because I'm not very prepared to speak about the IT part. I was going to tell you about the clinical part. I'm sure at least for those applications, we need to have external support. The medical file is also developed with external provider, so yes, you can.
Okay. And the second question, you didn't mention anything about the national patient file. Do you export to that?
I know that we are right now in the process of developing the interface for exporting this data.
Thank
yes.
you.
So thank you first and foremost for all the great work that you are doing. I'm for the past 13 years a client of this almost paperless hospital.
It is not paperless, believe me.
Almost.
No.
Almost. From my perspective, now
it's half paperless.
Okay. Included almost paper. They are not giving me paper anymore, which is a great step. 2 questions. One, it is, I see that all the reports and all this quality, all this assessment comes from the quality department, which from my standpoint, it is a very US way of doing things more than a European way of doing things, or an Israeli way of doing things, not a European way of doing things. How was this for you and for your team to set up this process and this analysis in a way that is not, how we say, the way that we usually do it here? So this is my first question. And my second question is an invitation, actually, because I teach at the seminar of the Digital Health and Innovation at Public Health in Cluj, and I want to invite you to tell exactly this journey to our students, because online, we are hybrid, so online, because we are missing this part in our seminar. We could not find yet somebody to talk about EHR publicly and about integrations of all the ecosystem, actually. We have people who talk about the rest of the ecosystem, but we don't have somebody to talk about the integration of the ecosystem, and the usage of the ecosystem, and the challenges of the ecosystem. Yeah. So, thank you so much.
Thank you for both questions. Yes to the second. And for the first one, I'm nervous a little bit. Can you help me? The first question? How was it to actually... okay. Yes. Yes, it's American way, yes. We have a lot of international accreditations mainly for the quality and patient safety. And we learned from the US institutions that they always come to us and they always ask us, what is your measurable result and what is your benchmark and how do you know that you are in the right place? Yes, it's American.
How difficult it was?
Oh, it's absolutely crazy. I can tell you 1 hour, I don't know how much time we have, but what you see is been starting to be developed from 2021, and we are still in the process of developing. And benchmarking is the most difficult part. Maybe this is a proposal that I can make. I don't know if this is the place, we need to benchmark ourselves. We are not the best in the world. I'm sure that every medical institution has good results. We need to measure them, to measure them in the same way and to benchmark with each others. So this is about sharing good practice. Okay, thank you.
Thank you very much. I think that we will discuss later about the opportunities and the challenges that will expect the Romania trying to incorporate and to adhere to the European health data space. Okay, our last speaker is Sherban Timofte. Please, Sherban, the floor is yours.
Thank you very much. It is very, very hard to speak after all this good presentation. I want to invite you guys to a new round of applause to all my colleagues. Thank you very much. Please. I will try to keep myself very quick. I want to point three things in my presentation. What means to implement EHDS in Romania, what are the advantages, and a study case. And let's start with the first part about standardization. This is the answer to the how. We are speaking about standardization. Doing things at high level, at the national level, at European level, without standardization, it's like speaking without listening. I can speak with you, you can speak with me, we can speak a lot, but if we're not listening, this is not a conversation. This is just trying to say everything that we have on our souls, maximum. And that's not efficient. Even for simple things like communication, we have standardization. For an interview, we are putting questions, waiting for responses, putting follow-up questions, etc. But for medical, from the medical perspective, it's way much harder because the patient is different. I'm a total mess as a doctor because I don't know where I put my blood test 1 year ago. And if I try to explain to my doctor what is in that blood test, I will say, okay, I have maybe, I don't know, high density cholesterol a little bit higher. What means a little bit higher? Between 2,000 and maybe 400. 100 and maybe 400, etc. There are some values out of my mind, of course. But about standardization in medical area, we need to embrace a standard, a point of information. In Europe, we have ESMO. In America, we have NCCN. We have also ABC7, etc. And embracing this common standard, having a standardization, like asking for the same thing, will make our life easier because we will break a barrier. We will have, reporting to the same standard, some structured data. And I want to show you this slide, and I want to give you some seconds to see it. Well, sorry? I have at the end of the presentation. So, here, maybe we can see that we don't have data in Romania. How many of you have this opinion? Raise your hands. We have data? We have data? Okay, okay, totally agree. Totally agree with you. Okay, okay, that's pretty interesting. Yes, we have a lot of data, and I'm not looking just at Regina Maria. I'm looking at CNAS, our national insurance company. They have thousands of data. They have raw data. That's data. It's not information. We cannot extract information from this data. That's our big issue. Because let's take a pretty simple example. Estrogen receptor value, it's a value. It's data, somewhere in the database, yeah? But estrogen receptor value 18 means something when we know that HER2 is positive also. If it's negative, it means totally other things. And the oncologist knows better than us what this means. So we don't have this power to transfer data into relevant information. And that's our big blocker for cost effectiveness analysis, for researches, etc. So, I want to show you when you want to cooperate with me. Also, this is another example, but I want to keep in the time. I want to see a study case of eOncoHub. And what this means, we are embracing basically a standard here. We are reporting the data, the patient data, to a standard, which is the ESMO guide. And our pilot is in breast cancer oncology. What this means? That we know the common part of all the consultations. There are the biomarkers. Every oncologist will ask what is the estrogen receptor, what is the progesterone, what is the TNM classification, etc. And they are going to reference to a source. In our case, in Europe, is ESMO guide. And this example I'm going to show you is, in the next slide, is exactly this kind of transforming data into information. We have the data, we have the data which are the biomarkers. We are going to try to interpret this data using different technology, maybe AI, maybe some other automation, etc. But our final goal is to create a patient profile which is going to see, okay, for this patient, with this information, with this data, our official guideline, ESMO, tells us this. The first time of treatment is, for this case, I don't see it. Okay, I don't see it. Thank you very much. And also, we have very different, if we're going to go in, if we're going to read all the ESMO guide, we will see thousands of cases. Unfortunately, our doctors memorize it. They have thousands of patients and they know that guide from the page 1 until the end. But sometimes the guides are changed. Maybe sometimes we spend a lot of time looking, trying to connect different diagrams from the ESMO guide. Well, what I wanted to tell you is that this is a standardization. Remember the first slide. It's a standardization because we are referencing to the same source. We are transforming data, patient data, into information relevant for the doctor. And this is an advantage of EHDS. What happens there? Basically, they're telling the patient data should be available. There are. The patient data should be relevant, should represent an input for the doctor. We're transforming in information. And having this, we can be ready to have 75%, maybe when we're speaking about patient registries in Romania. And I want to close all my presentation with just one slide. This one. I want to let you reflect to this flow and to put all the questions in the background. Thank you very much.
Thank you very much for your presentation. Yes, you can leave it on the last slides. I think that going and structure the medical data according with the guidelines that societies provide, it's a very good idea. But we also need to think that we need to put technically the data in a structure that to be able to be seen not just the physician from one place or one country, but by the physician all over. And yes, standardization, I think that you draw the line, underline the importance of standardization, that we need to align all of us. Because if, for example, at the Romanian level, we don't give the instruction to all hospitals, for example, when they develop their medical health records, because all hospitals has some sort of electronic system for the hospital. But how to do them? Yeah? with the standard, because each hospital have any system that they have on the market. And standardization and structured data is very important in order to be able to think that in someday we will go into European health data space, because otherwise we are nowhere. Yeah, it's very important what you say. Yeah.
Sorry, thank you for the presentation. Did you start developing the structured templates?
Sorry?
Did you start developing structured templates? Did you adopt something from outside?
Yeah, basically, let me answer to both questions in this order, because I hope to not forget anything. About the hospitals, first of all, I would be very, very happy if all the system would work 24/7. This is a big issue in Romania. So this is the first step, to make usable softwares. For the second question, yes, what I presented to you is a way of standardizing. Basically what we did, me less, my colleagues more, is to speak with specialists and to try to ask them, what means a consultation for you? And we took this pilot on breast cancer because it was easier for us. Please? Yeah. I'm not, it was... I think that is here. No. I think that this is what you want, right? This is the part, right? So basically what means we spoke with different specialists and we tried to extract the common part. What is the common interest? What is the important part for the specialist? What is the important part for the radiologist, etc. And we try to put as a backbone in one UI here, in one user interface. Of course, there are subjects to increase this. That's why we put also this new deep dive view, because what you see in the left is just something at the top of the guide. Here is a deep dive view, because that's what is very important for the doctor to know, the drug at the end of the day.
Other questions from the room? Yeah.
We have a question from online. What are the main challenges of integrating oncology data into the European health data space ethically and securely?
The security, as my previous speaker told, there is no 100% secure system. We are the specialists in cybersecurity are basically working on the systems, tries to make it perfectly secure until a new hacker finds a bug or finds an error. And of course, humans are hackable, as my colleague told you. So that's a lie that we can create a 100% secured system. Maybe there are some discussions, but I don't think that is the moment right now, about the blockchain storage, etc. But also we are speaking about some public information hashed and put it in a blockchain. This is a longer discussion. Ethically, that's something very hard for me to answer because I'm not a doctor at the end of the day. I'm an IT guy. So, yeah. But what I think that is ethically is the security problem. Because ethically, we can think that what happens if I put the data there and they are accessed by an unauthorized hacker or by somebody else. And that could be something ethical. But again, for me, as an IT specialist, it's very hard to speak from the ethical point of view of a doctor.
Okay, security.
Thank you. I know we keep talking about these hackers that attack systems, but believe me, the real problem in any organization are people who are trained to not click on certain emails,
Yeah.
but
Yeah.
then considering oncology systems and oncology data is highly sensitive,
Yeah.
what they do is they see the data that they work with every single day, even if it says clearly confidential, sometimes even in large red writing, they still talk about it outside work. They still talk about it through WhatsApp. They still text and share that data even with public AIs, something that they definitely shouldn't be doing. I mean, every single person has an NDA there that's restricting them from sharing this data, but they are simply not conscious of it. So I am sure that whatever company and software you guys are using is 100% secure. The real problem is, how do we train the employees? How do we train the partners to stop doing these leaks in very simple ways?
Let's take a very trivial example, looking at the root cause of why we're sending documents on WhatsApp. Because I did this, I have to admit, theoretically WhatsApp is end-to-end encrypted, but yeah, you know. I'm doing this because it's very hard for me to keep track of everything. I cannot go to a doctor in this moment to present him all my blood tests from the last 5 years. Because there are physical papers in my house, I moved plenty of times in these 5 years, and I don't have it physically. I store it in a cloud, in OneDrive, in Google Drive, etc. you want. But I don't have it. And of course, we're speaking about usability, because this is a very big issue when we're speaking about cybersecurity. Security should be usable. It's easier for me to send on the WhatsApp that PDF rather than going to a copy shop. I don't have a printer at home. To print that paper, to go with it in my hand to the doctor, and let's be honest, how many patients a doctor can see in one day? How many papers they have? For this specific example, from my point of view, it's a procedure issue because we don't have that common point of accessing data. Please. Yeah. Yeah.
Incentives / consequences.
Yeah.
If the incentives and the consequences will change, the people are smart enough to change
Yeah. Yeah, totally agree.
However, you can change the consequences.
Yeah, totally agree.
Yeah, I will let the audience for the ethics, yeah?
Yes, for ethics, hello. My name is Alina Comănescu, and right now I'm speaking as a member of Independent Data Monitoring Committee with ERTC. It's the European Organization for Research and Treatment of Cancer, and we had a various working group on ethical dilemmas of EHDS, and I think that the first one is directly linked with equity, because digital health literacy and health literacy varies across Europe. So if we are talking, the Romanian patient is the least health educated patient. So its adherence to this European data health it will be minimum. So this means a larger gap in European health inequalities. So ethically, I don't know, maybe we can train or educate, have some education campaign for Romanian patients to be more adherent to the idea of giving their health data. And the second one, it's a bias in data and AI, because if you start with the lack of, I don't know how to say it, of diversity across Europe from the data point of view, then of course the AI will develop something based on what he has access to. And in our I'm sorry, I'm very tired. In our view, the stakeholder representativity should be, I I don't know, should include all the relevant stakeholders, especially patient experts in data and ethical aspects of European data health space.
If I may, European Union has directives and regulations that provide all the procedures and all the policies that all we need to do is literally just transpose them into our national legislation, and after they're transposed, then all we have to do is just apply them. It's so simple. It's literally right in our faces.
I agree with you that it's simple, but where is the government here?
No, don't get me started.
Did they know that?
No,
yeah.
I refuse. Don't get me started on that.
It's ongoing. It's ongoing. It's work in progress from, I don't know, 10 years, 10 years, yeah, it's 15, yeah.
Our solution is literally to avoid interacting as much as possible with the government, because we are a team of specialists. We know what we're doing. The only thing that we're saying is, please don't get in our way. We have EU regulation, we have worldwide regulations. We comply with those. That's what we're doing. That's what we're implementing. Unless you're helping, goodbye. The prescription, the paper prescription.
Yeah.
I could add also on the cancer, there is the National Competence Center. So there is also high expectation from their side maybe to push things into the right direction. So they are in charge of aligning with the Horizon mission as well.
There are another question from online.
Yes, another question we got is, how is National Institute of Research, Bucharest, contributing to the technical infrastructure needed to connect Romania's health data systems to the European Union?
Want the microphone, yeah.
We have our infrastructure put in IRIS infrastructure system, and also we have a special compartment for cybersecurity, and we have cybersecurity structures which we can put together with other ones in order to create cybersecurity facilities.
Who was the national? Okay.
Needed for?
For connect Romania's health data systems to the European Union.
I don't know to answer this question.
Maybe
I think so.
Maybe I can. I can answer. Maybe there are some ongoing projects for high performance computing, and also these are called the gigafactories.
Yeah.
And yeah.
Yeah.
So they could.
The cloud, the Romanian cloud. Yeah, it's supposed to be in the Romanian cloud.
Thank you. I'm in the IT area as my fellow colleague here. So I wanted to ask right now, from all private solutions, digital solution, where are you storing now the patient records, the patient data, which is very sensitive?
And in which way?
Do you ask me as with this pilot solution or me as a state, as Romania?
This, I would ask if you know Regina Maria, where stores all the data, because they have developed systems and integrated systems, so they have a lot of data. Not the paper one, but the digital one.
So, I don't think that my answer is very relevant because I have a pleasure and I created a small server in my house, basically. But this is for a pilot solution, this is not scalable. So this answer is not quite relevant. In general, we are embracing cloud. That's the era. Fortunately, in the European Union, now we can choose to, I think that all the cloud providers, but at least for the biggest cloud providers, we can choose the region of storage. So we can at least make commercially sure that we store our data, our application data, in a country. That's at the commercial level. At the technical level, as user of the clouds, we don't have any guarantee that the data are exactly there, but we can, from my point of view, we can trust the commercial agreements with the big companies that are guarantees that there is a data center, I don't know, in Poland, there is one for Microsoft, which stores our data.
Ideally, it should be in the governmental cloud, ideally, because it's very sensitive and personal data of Romanian citizens, although maybe the business, it's a foreign business, right? Regina Maria, it's not a Romanian business.
We are speaking here about a sovereign cloud. I'm totally agree. There are governments in Europe and especially in the United States and Asia that have sovereign clouds. This is the best solution because they have an isolated infrastructure. In this way, we can make sure that only us, as, I don't know, CTC in Romania, will have access to that certain data point. The commercial company that created the cloud will have a soft cut, will not have access, as a commercial company, we don't have access to that data. But it's very, very expensive. We are speaking about billions for sovereign cloud. Yeah.
But they are building it right now. I hope it will work properly. That's the problem, implementation of the governmental digital systems. We will hope that everything will be all right, and who knows, maybe there will be a slight legislation and regulation adaptation nationally in order, for example, the private networks to store the data on Romanian territory or Romanian governmental cloud. Why not?
For example, in the Shift Hub, we store it in the European Digital SME Alliance, so they are based in Belgium. And we had also a partner in France, which were providing this connector to the EHDS. But we were not able to set up in Romania. There are some initiatives, but...
So even our data are outside Romania when they are stored somewhere.
And I learned from the government official that this is it might be a potential big deal. So this is why but we don't have the infrastructure. It's like you have to park your car here, but you don't have parking lots. It's the same issue. So we need to be fixing this.
Very good question, and it's really important because I work in hybrid places. I am only speaking from a private perspective. We store sensitive data in Switzerland. There are 2 data centers under Geneva that are literally protected by their military defense. But this is not military data, this is private data. We are enterprise partners, and any data that's sensitive above a certain secrecy level, it goes to Switzerland. It's stored there, multiplicated securely, encrypted in place, encrypted in transit, and we have the 100% warranty that even if the entire infrastructure communications infrastructure, storage infrastructure fails, our customers' data is still there. Because the Swiss guaranteed us with very large penalties. So if they don't make it available back to us, we can pretty much build a data center just from the penalty. So that's what we're doing. And it doesn't cost the bank. There are options depending on how many terabytes of data do you need stored, how many terabytes do you need in traffic, and yeah, there are ways we can do this until Romania will have indeed the governmental cloud. That's being built, has not been completed, but when it will be completed, we will have indeed all the data centralized by the National Digitalization Authority. Until then, what we are doing with customers that need to comply with certain very specific laws, and they need to keep the data within the national borders, because we do have clients that they cannot export it, not even to Switzerland. It needs to stay within the national borders. Then we're talking about tempestization. We're talking about a special room that's electromagnetically shielded, and the data is safe there, and of course backed up for resilience in another location. So there are solutions.
When I'm listening to you, I understand what the patients feel when they are in the room full of doctors. So, okay, I hope I understood half of what you said, and I hope I will be able to answer to you half of what you asked me. I know that we have a department, because you asked me how many people we have. There is a department in charge with data protection and security. I know that we have several servers and backup servers, and I don't know any other mechanisms, but I think that we are pretty well in this area of data protection. Next time I will invite our data protection officer. So. Thank you.
Thank you. Me again, Avocatus Diaboli, I'm sorry. It's good that you talk about the money, because we are so mesmerized about this European data platform, unified, that maybe we forgot why do we want to do it. Because we want to extrapolate or to extract as many information as we can in order to they said to benefit the patients, but according to our working groups, it's not so true, because new technology may exacerbate financial toxicity by replacing less costly alternatives, yet equally effective, promoting unrealistic expectation, and we think that this might create some discomfort or toxicity for the patients, because they will increase the out-of-the-pocket costs. This is our assessment until now. So it's a good I'm sorry, I'm very tired. It's a very good news for you, because we are advocating for health technology assessment integration into clinical practice, which is our hope for the next years, and to ensure reform to update digital reimbursement structures. But keep in mind that financial toxicity will happen after we will be one united health data space. Thank you.
Thank you. We have other questions from online? No? That's all? Okay, that's nice. So, because our challenges and also ethical issues, my question is, have we in the room an ethicist? Yeah? Okay.
Do you hear me? Yes. I'm very curious about, there will be new incoming systems. One is related to electronic system healthcare that will be by national system, 100 million euro or something like that. I don't know if you are ready to connect with that. Also for the next year will be digital wallet for medical. That will be European kind of standard. Are ready for that regarding the data interchange? Do you know what I mean? Digital wallet, it will be in 2026, it will be digital wallet for medical. That will be, no? There will be standard. EHDS, but it will be standard for the next year. Are the systems ready? Do you have anything in mind regarding that?
It depends. We are ready. We are ready. We, in the room.
Okay, I have a question. If I'm a patient to Regina Maria and I was consulted by an endocrinologist and the endocrinologist recommended me to see a cardiologist, did the cardiologist is able to see my health record without my consent or not? So, or how it's working, in fact?
Actually, at this moment, a physician can access the medical file of his own patients. So, if you are a patient of the cardiologist, yes, the cardiologist will see at this moment your medical record because he needs the medical information. Your consent is already given when you entered the consultation room.
When I book the consultation, I give my approval.
For any consult?
No, for the cardiologist consult. When I book my cardiologist consultation,
okay.
After, so the endocrinologist sends me to the cardiologist.
Okay. And without the consent, you are not able to book the cardiologist?
Yeah, no.
Okay.
Thank you. Merci.
Then I have to call, and maybe then I have to go with things in paper, which I never do.
It would be also in your medical interest that the physician would have access to your medical file, because the medical decision is made not only on the basis of what you tell, but it's also made on the basis of what is written in your medical record. What we did is to restrict the physician access to other patients' medical files. So if I'm not your patient, you will never be able to see my medical record. Okay?
So, as far as I saw it in my 13 years with Regina Maria, is that when I go for the first time to a doctor, they then start, when I enter the room, they then start browsing only my medical file. And it takes them 5 minutes, 13 years of paper.
For a young lady.
To understand where I'm coming from and what I'm doing.
Okay.
Yeah.
Okay, thank you. So now imagine that we are in the era of European health data space, and we are in 2027, let's say, and 2 years after the entering this space. How do you imagine that it will be the access of the physicians from Romania for their patients, and also for this physician from the Romania from a patient abroad, from example from Italy or from Spain?
I saw a simulation which I love. I dream about every night. So you open
issues.
Yes. So I think that this is the way that the medicine will go.
Thank you very much.
Maybe you can consider also virtual doctors now in the future, so there will be no need for the physician. If
I'm not sure about
this is an ethical question. Not
Yes, I would not ask about it.
Now, do you think that, because Regina Maria, it's a private sector, but let's try to imagine that we are in our hospitals, public hospitals. Try to imagine where these public hospitals will be regarding the European health data space.
Yeah, definitely it will be a struggle for the hospitals. You know that they had a lot of ransomware attacks, and as my colleague also mentioned, it's also difficult to keep their IT systems up 24/7. They don't have data centers or specialized people to handle incidents. So indeed, that would be a challenge. So.
If I may, I would not speak like this about the public hospitals because I attended some conferences where they present some very, very special features of the medical file, of the electronic medical file. So they maybe is nobody here from a public hospital, but they have developed some aspects which we didn't manage to do.
Yeah, but generally the private hospitals digitalized more than the public hospitals.
It's more investment,
yeah.
But they have brains. They have lots of knowledge and they can do things.
Yeah.
I would go a little bit lower because I would say that the first step is to make sure that in Romania we have a usable infrastructure, and I'm looking at CNS right now because I had the opportunity to see an information from their site that I asked them why DES does not work and why CWE and other softwares are going down a lot of times. And there is a public interrogation. They told me that their server is before 2000. They don't have hardware, they don't find any more hardware pieces to replace the broken ones. That's the stage now. If I would be optimistic, I would say that we can speak in 2027 about multi-cloud transfer of data when a doctor, and I'm thinking of the collective right now, a doctor from other country, when he see the patient, Romanian patient in Belgium or whatever, he would be able to access his data in Romania with the patient agreement or with whatever emergency contact agreement. But we are far. It's very, very far. Because in this moment, we are not able to make usable software in the health system. We cannot guarantee an SLA using cloud, an availability of at least 99.9%. When we are going in private cloud, when we're going in to look at cloud created by private companies, we are speaking about 99.99 after the dot. And there is a huge difference. We're speaking about difference of availability of not working 1 day per month at not working 2 hours per month. We cannot guarantee any SLA, any availability in this moment. And that's the sad part.
And let's remember that we spoke until now about hospital, private hospital, public hospital, but not about rural areas with a lot of patients, with about nothing like ITC infrastructure. And here is a big problem for our country.
Yeah, the big problem theoretically in that rural area is the electricity. And in some of them, yes, yeah. We still have problem with electricity, and without electricity we don't talk about electronic health records because it's not working if you're trying to do something. And maybe the connection. And I think that something is supposed to be happen in order to also to gather and to imply all the population, not just the population from the cities and from the, let's say, bigger communities, also the smallest communities. Yeah.
If I may add 2 points to our discussion now. The first one has to do with over-reliance on AI. AIs today and in the next decade have a major flaw that's literally called hallucination. Yes. So the AI may tell you, if you don't verify it, if you don't double check it, if you don't do due diligence on the data that the AI is providing, you may be taken by the AI in a completely wrong direction.
Correct. Yes.
So this is why we cannot replace doctors, human doctors, with AI. And we won't be able to do it for the next decade at the very least. Because, for example, I use 6 different AIs. And when I get them to double check the data, each one of them has certain flaws. So you literally, you cannot rely on one AI to do it.
This is why AI only gathers data and provides them to me. It's my job to interconnect and to think about what is happening to the patient. Yes.
Exactly. So the AI's job needs to be to structure the data. Yep. So then it will be easier for us to read it and interpret it. Yeah, it can give me a report to see if I'm going in the right direction or not. It can summarize data for me, but it's no more than an assistant. The AI is a tool, just like a fork or a screwdriver.
But very useful.
Absolutely.
Can provide hints, but the medical personnel is in charge to decide the diagnostics and the treatment. For AI, can provide some ideas,
some summaries.
But the medical personnel is in charge to have the decision of treatment, of cure.
Absolutely. My second point is my solution, my team's solution to the lack of help, to the amount of barriers that we meet here in Romania. And our solution is we only work with the people that have an objective. In the moment when you see that flag on that hill or on that mountain, you know that you want to get there. If they're all over the place, they don't know what they want, it doesn't matter if they don't have the right resources. We can adapt. We can find a lot of programs, EU, worldwide, European Bank, World Bank, it doesn't matter. We can find the funding. The money is not the problem. The conceptual framework is the problem. Yeah. Right? We can take them on the journey to reach their objectives, but most of them, they don't have this objective. They don't even have a strategy to understand that, okay, this is what we need to do, and this is where we need to get to. I think this is the core problem that we have here in Romania, the lack of structured strategy and clear objectives that we need to reach.
Yeah, I'm agree with you that, but because without a strategy is nothing. But I think that the main barrier in here, in European health data space, is that each of us as Romanian citizens must agree to put our data in the European space. And my question is, are we ready?
I can give also an example. There are other data spaces there are for manufacturing data, for various other verticals. And in other verticals, it's a matter of monetizing data. So you provide data, and then universities, research institutes, or any interested stakeholders can use the data, can do applications, can do
It's general
make
good.
money out of the data.
Let's say general good.
Yeah, in healthcare, indeed, there are ethical considerations. So.
But do you think we are ready?
So the other verticals are ready. So
we are ready to share our healthcare data with
It's not
Europe?
like we can choose. Again, one of our biggest issues is that we don't have a digital identity in Romania. Our CNP...
Let's say that we have it. Let's suppose that we have it.
Imagine that we are far.
Then the question is, do you think that it will be able to convince Romanian citizens to become digital? Think about COVID-19 and think about what the government think that Romania and how many vaccinations they need. And think about what's happened. Because it's also healthcare. So are we ready to this?
I personally, I am.
You are.
I want it. Me and other thousands of people want to be able to don't send the PDFs to my doctor when I'm going to a consultation. And if we are very, how to say it, if we are asking ourselves about privacy of our data, let's try to put these relevant questions, or video put it. What happens if I send it on WhatsApp with this data? What happens if the doctor goes and stores randomly my personal blood tests in his cabinet and, I don't know, somebody will break it?
Accidentally, not necessarily with intention, yeah? Because sometimes it's happening without intention, yeah?
To break a cabinet? I don't know how to say it. It's about, it's all about understanding the advantages and prioritizing for ourselves what we want. We are asking where our data goes. It's a valid question, but what's the alternative of this? Storing the data as we did until now, and maybe we should start asking, what happens if somebody will intercept my message on WhatsApp? What happens if somebody will break my doctor cabinet? There are also security issues.
We also have some statistics.
Okay.
Let's say we have 6 million patients, and out of these, there are less than 100 asking about their data. Does it tell you anything? So they are concerned about the confidentiality, they are concerned about what happens to the medical history, but it's around 100 of them out of the 6 million.
Okay, and do you think that your population is representative for the Romanian population? Because
I think it's the most aware population, because we have corporates, we have young people, we have lots of millennials thinking about and very aware of this subject. So maybe we see the problem like this.
Okay. Yeah? No, okay.
My answer at this time will surprise you, but I think we are ready. Not at country level, obviously, not at public level, very obviously, but we are ready to work with professionals like Regina Maria. Those who are ready, who are leaders in their fields and in their sectors, they will always do it right. They will always comply with the legislation, with the directives that will offer us, this time as a consumer, not as a partner or leader, the trust that I need that they are not doing anything funny with my data.
You told about the private companies, and I totally agree with you, but relevant digitalization at national levels and European levels is starting from up to down, from government to the hospitals. Because there are, at the end of the day, public services. And that's why it's very important to be ready as a country, not just as private companies.
If I may add also, coming back to the idea, you could use this data also to enroll into clinical trials, or you can incentivize people that maybe are reluctant to share the data, to come with some benefits. I've seen also gamification works. So if people share the data, they get some discounts maybe for some clinics or others. So.
I think that the people with some level of culture will be ready to share the data, but the general people, which is 80%, like say, don't be. Because they think you have to do something against them and to use for have your money with their data. It's like in vaccination.
I think that we need to act on more than one level. And I'm agreeing with my colleague here with the top-down request. Always, it's the same as with standard in medicine. Yeah? If the government imposes that all the medical health records must comply with the standard, everybody will comply if we have the request. But besides constructing the infrastructure, we need also to construct the culture of sharing the data, and we need to start them in the same time in order to reach something. I don't know, I'm a pessimistic. I think that in 2027, Romanian physicians will be able to, let's say, extract the information from the electronic health data space for an Italian or Spanish patient that is in Romania. I have some doubts that it will be for any patient from Romania that it's going in Belgium or in Italy, that he or she will be able to share with the physician from their healthcare records. Okay, to end up, I will let you.
I have my daughter in Scotland, and she is a patient of Regina Maria, and come with a lot of results. And in Scotland, another set of analysis to have the same results and to compare. They don't use it.
They don't trust them.
Yeah.
Yeah, that's great. I don't trust you. Yeah. To conclude our panel, because yeah, I will ask each of you to think to a conclusion or to a thought about this European health data space and to the benefit for the Romanian citizens. I will start with the ladies. Yeah?
Okay. I told you in the beginning, I believe in sharing data. I believe in the benefit for the patient. I really believe in it. I also am aware of all the problems and all the troubles that we will have until we will have this type of free access to clear medical information.
Thank you.
I believe in the importance of sharing data and have a more complete diagnosis for our patients, but I still have doubts about the possibility of Romanian infrastructures and policies for doing this.
Thank you.
Since the two ladies started with I believe, I'm going to continue on this trend. I believe in complying with legislation. I believe in learning what digitalization actually is. because it's a process of optimizing our life, our physical life. If we use the right tools to do this, and that includes sharing the data with the European cluster, it would be much easier for us, like your daughter, to travel between Romania and Scotland, well, UK, and not have to do those lab tests twice. So there are many benefits, but they need to be explained, because if people don't understand why they need to do a certain process, then they'll never do it, they'll never reach it. And what George said with gamification and incentives, these are indeed two solutions to get them to comply with the legislation and then to do to fulfill the objective that we give them.
So beside what we do at the level of our infrastructure, we also need to do education. Then we believe also in education. Yeah, thank you.
So yeah, to continue, I believe also that education is important, because this data space is a natural evolution. So we have cloud, we have database, and now data spaces are something that people need to be educated. So I don't think in universities they are teaching about data spaces. This is a quite recent concept, and even in technical universities they need to update the curricula. And yeah, I'm optimistic, so I think this concept of hub, so I see Onco Hub also in our project Shift Hub, so to have a community and to try to make this concept known and people to trust in it is important.
Okay, thank you.
I have just a conclusion of what you all, I try to summarize what you all told, because there is nothing new from my point of view. There are two big challenges. The first one is interoperability between public institutions and private institutions and private companies. There is a big challenge. The second one is about trying to understand the benefits and trying to educate ourselves to understand what means data space, what are the advantages, and how can affect our lives. And yes, I believe in data sharing.
Thank you very much. Thank you very much for being here in this panel. I think that we have a nice discussion, and we share knowledge and experience, and why not? Maybe we know each other in this context. And yes, I believe that we can do it. The question is just, we want to do it, and this is the question. Thank you very much.